The most common conditions that we treat are ischemic strokes, when you have loss of blood flow to a certain area of the brain causing a stroke. We also treat hemorrhagic stroke, which is the opposite problem where you have bleeding into the brain. And then there are a variety of disorders that can affect the blood vessels, the arteries, and the veins in the brain that can lead to different issues. When someone has a neurological symptom, there are multiple different parts of the nervous system that can be affected and create a similar presentation. When we do our exam, though, we can tease out a large portion of that just based on our exam. So there are certain things that will present differently if a nerve is being affected versus the brain is being affected, for example. Taking care of patients and for stroke care in particular, we meet them at a time when they're sort of most vulnerable in terms of what's going on with them and need the most attention. There's a lot more therapies that have been shown to work in the past few years, which is very exciting for us. And so being able to offer them new treatments, being able to offer them enrollment in clinical trials, which help to advance our field and may give them even more of an edge in terms of their recovery. And then I think watching them throughout their hospitalization and then ultimately in the outpatient setting and really just getting to know them, seeing how they improve over time, helping prevent further events and further strokes has been a really rewarding aspect.